Hello friends, my name is Dr. Shailendra Ganjewar. I am an interventional cardiologist at Mediterranean Institute of Medical Sciences, Nagpur. This is the only NABH accredited hospital in the Nagpur. I am here working as an interventional cardiologist and a director of cath lab. Now today we will be talking about the heart attacks, its treatment and the prevention part. Now, heart is a very important organ in our body. It is supplying blood to all the organs throughout the day and night. It is working 24/7 from our life to death. So, it is pumping and working throughout our life. There are three arteries which are supplying blood to this pump. These arteries are called as coronary arteries. So heart is supplying blood to all the body, and these coronary arteries will supply blood to the heart. The requirement of blood by heart is very high, so these arteries are specially designed for that. As we grow, cholesterol goes and sits in these arteries. It forms blockages gradually in the coronary arteries. This process is called as atherosclerosis. Usually by 20s or 30s, the process of atherosclerosis begins in our coronary arteries, and gradually when these blockages increase, we are at risk of developing heart attack. Persons who are smokers, tobacco chewers, diabetics, all these persons, the process of atherosclerosis is very fast and they are prone to develop blockages and heart attacks at early ages. Nowadays we are seeing many young patients coming with heart attack, and the main reason behind that is smoking or tobacco chewing. Now, when these blockages in the coronary arteries are more than 70%, usually the patient either comes with episodes of angina, or directly he might come in emergency as a heart attack. During angina or chest pain, the patient gets typical retrosternal pain which goes to the neck, which goes to the left upper limb, left shoulder. The patients get sweating also, palpitations also. So these are typical symptoms of heart attack which are called as angina. Now I will request you that whenever you have all these symptoms, you should be rushing to the nearest hospital. You should not ignore your symptoms, and if you are not having any symptoms and if you are more than age of 40 years, you should be going for regular health checkups. In that, treadmill test, ECG, 2D echo, these are the important investigations a cardiologist will do for you. If unfortunately you land up in any heart attack, as I said, you should rush to the nearest hospital, take whatever the treatment is advised. You should go for the further investigations in the form of coronary angiography and, if required, angioplasty or bypass. Now, there are a lot of myths regarding angiography, angioplasty and bypass. These are time tested procedures which are done regularly in most of the good hospitals. In angiography, either we go through the radial artery route, or we go through the femoral artery route, that is through the thigh. This take hardly 10 to 15 minutes to do an angiogram, but that will give complete idea to you that how many blockages a person has. In angiography also, if the blockages are less than 70%, they are called as minor blockages, and that can be treated with medicines. Only if the blockages are more than 70%, then we advise to go for angioplasty or bypass surgery. There are myths that once the angioplasty is done or bypass is done, patient will have many problems, many issues, or he might have recurrent episodes. Unfortunately, atherosclerosis is a disease which is a progressive one. So those patients who undergo bypass surgery, angioplasty, most of them will do well, but in some patients, that is 5 to 10% of patients, they might have recurrent symptoms, and they may have to go for repeated procedures like repeated angioplasty or repeated bypass surgeries, and this is very common in diabetics. So what I will advise is that if anybody undergoes angioplasty, bypass surgery, still he has to take his medicines regularly. he has to go for a regular follow-up with his doctors, and he has to maintain a good lifestyle. Now we'll come on a prevention part. If you want to prevent your heart attacks, I will advise you to go for a good regular exercises. In that, walking is the most important exercise which can be done. Very simple. You have to go for a walk in the morning, and you should be walking at least 4 kilometers in 40 minutes. That is called as aerobic walking. Or you can go for a cycling or swimming. You should follow a good diet. That means you should be avoiding any diet or any food which is having a lot of cholesterol, like oily food, non-vegetarian diets, high caloric drinks, bakery products should be avoided. You should be taking more green leafy vegetables, more fruits in your diet, and less caloric diet is preferred. Maintain a good lifestyle, be less stressful, go for mental relaxation techniques, take breaks from your busy schedules, and if you do all these things, I am very sure that you might be preventing your heart attacks also. Thank you.